Hi guys, welcome back to the Dental Debrief, the podcast where we talk about the nuts and bolts of dentistry. I'm Tim, this is Maheer. We run our clinic, Azure Dental, out of Perth, Western Australia, in the suburb of Inglewood. And today we're going to be chatting about common dental diseases. What would be one of the most common dental diseases that you've seen over the years?
Yeah, so obviously we're trained in gums, we're trained in teeth. Those are obvious. But something that I definitely, and I'm sure you have, we're seeing on the rise is the broken tooth, the cracked tooth, especially the painful cracked tooth, that symptomatic one. Usually you're getting pain on biting or cold or sweet.
Why do you think we're seeing more cracked teeth?
I would personally say it's probably because we're seeing traditional old school dentistry that wasn't glued in, it's starting to fail. And it's not designed the way that we know teeth are designed now. So before, when we used to look at teeth, especially 100 years ago, they used to just cut and make a little section and they'd look at it in a microscope and see only about 3 layers. And now we have much more advanced microscopes that show within these layers there's multiple layers and multiple structures and things. And evolution has done such an amazing job to create a tooth for us. And now modern dentistry, usually, as soon as you put a drill in it, we're actually just cracking that tooth. So Tim, what about you? What have you noticed dental diseases wise is on the rise? Are you seeing a lot more of?
I think something that they didn't really see a lot of in the past was teeth falling apart. That was not really an issue until dentistry came along. The issue prior to that was decay. So I think people think of a dentist as treating tooth decay all day, whereas about 70% of our job is servicing old work. And the problems that we see with old work is usually the tooth falling apart because just too much has been done to it. I think the phrase flogging a dead horse comes to mind, where sometimes these teeth have just been worked on so much, there's so little tooth remaining, and as soon as the patient, bites down on something hard, it's like clinking 2 champagne glasses together really, really hard, and the tooth just shatters,
Exactly.
And they can be tricky to fix. They're much easier to fix if we get into them before they break. Why do you reckon we're seeing more cracked teeth? Why are there so many more teeth with these problems?
It's a big question. So I think fundamentally, old school dentistry didn't line up with the way the natural tooth was made. And so as soon as we drilled these big grooves and big slots for the metal fillings to sit into, it just would promote the way that as you bite on this tooth, the tooth's moving in all these different directions. And the only way for the tooth, all that force to kind of dissipate, to release, is for the tooth to split and crack. It's sort of like a crack on a windscreen, crack anywhere you see. It starts off small, it looks really benign, and often dentists were always told to just watch these things, and we just monitor until it just breaks. So I think that's where we have to really change. How about you? What do you think?
I think, exactly what you said. The old dentistry was really invasive. You had to cut away a lot of tooth to make room for these weaker filling materials that we had back in the day. When you cut out all of the inside of a tooth, you end up with a tooth that's like eggshell thin on the outside. And as soon as any force is on there, that tooth's just gonna break. If it breaks above the gum line, we can usually fix it. But if that fracture goes below the gum line, they're very, very difficult to fix. And sometimes that's a death sentence for the tooth.
It just doesn't last.
I think that another big issue is that in the past, we had 2 materials to choose from. We had amalgam, which was really, really strong, but it's black and silver and it's got mercury in it. And we had composite resins, which is our plastic filling material. Now that amalgam's gone, we're doing a lot of plastic fillings. The problem is that plastic fillings only work well in small and medium-sized fillings. As soon as you're getting into a situation where the tooth is more than about 60-70% filled, that plastic filling is just too weak to support the tooth, and that's when we see teeth falling apart.
So Tim, have you ever suffered this problem? I think you might have in uni, in fact.
Yeah, I think it's classic dental school where there's nothing exciting happening. So me getting a crown on a cracked tooth was the biggest thing, I feel like everyone knows about my gold crown that I got in uni. The funny thing is that I cracked that tooth, I got a filling done and went home, and my ex-girlfriend's mum had made spaghetti bolognese, and I chewed on an olive that had a pip inside it. It was about 48 hours after that filling was done. If I wasn't a dental student at the time, I probably would have blamed the dentist. But the issue was that filling was it was a filling replacement. So I already had a filling there. After it was replaced, the filling was just a little bit bigger, and just that loss of that little bit of extra tooth structure just completely weakened that tooth. So as soon as I bit on that olive pip, the tooth was split. Right? Gold crown was put on there, which was the old school approach. This is probably done 12 years ago now. We wouldn't do that now. What would you do now?
We've got adhesive. So we used to cut away so much tooth because we'd have to find a way to keep the filling in or the crown in. But now we've got the glues that we have, the adhesives are as strong as the natural tooth glued to itself. So now we would just do something to bond, to staple that tooth kind of back together.
The traditional treatment for a cracked tooth was a crown. The idea was that if you had this metal or ceramic structure wrapped around the tooth, it would hold everything together. But in reality, so much tooth is cut away for a crown that the tooth starts flexing and moving. So those cracks just continue to progress underneath the crown. We'd normally tell patients, about 70% of you with a cracked tooth that we put a crown on will need a root canal within 10 years. That's not because of cracks. That's just because of the nature of the treatment that we were offering, which was old school crowns. Now, because we can bond the tooth back together with really rigid materials like ceramics, we can stick teeth back together almost to the same strength that they were before the crack. For patients out there with cracked teeth who might be experiencing pain on biting and those sort of symptoms and they're not sure what to do, what would be your advice to them? Number one, for treating the problem, and number two, for preventing the problem in the first place?
Again, yeah, prevention is obviously much easier than cure. So if you have these teeth that you're a bit suspicious on, you can't bite, there's this one tooth or one side of your mouth that every time something cold touches it or sweet, or you bite on it, it just doesn't feel right, get it checked out and try find a dentist that's kind of up to date, who does a lot of ceramic work, lots of adhesive work. They like to use a rubber dam or like the blue sheet that keeps everything really dry and really pristine. But if you do find an older school dentist, sometimes you might be at risk that their treatment, which is just what we were taught, might actually damage the tooth further.
So I've got a crown on my cracked tooth. It solved the problem. The pain on biting's gone away. But the issue with that is when that needs to be replaced, is there enough tooth there to do it again? And that's what I'm worried about. So yes, I've got 12 years on that crown, but when it fails, am I still gonna have a tooth there? And I think what's really important is to find someone who does sort of minimally invasive ceramic work. So there's more modern restorations like a ceramic overlay or a ceramic crown lay where we're removing much less tooth. So if that restoration ever fails, there's still enough tooth there to do that again. And we're not having to go to something more drastic like an implant.
Thanks for tuning in, guys. If you have any other questions, if there's anything else you want to find out more about, just drop us a comment, send us a message. We'll be more than happy to answer.